Hi everyone, Assalamualaikum. So today we are going to learn about developmental coordination disorder. So you want to know more? Let's jump into it. So here is the overview of what we are going to learn today. So we are going to learn about the definition, symptom, prevalence and diagnosis, causes, impact, strategies and conclusion for DCD. So, what is developmental coordination disorder, or we call it as DCD, is actually a dyspraxia, where it is a neurological condition that affect a person's ability to plan and coordinate physical movement. So, it's include gross motor and fine motor skill, balance, spatial awareness. So these difficulties are not due to a known medical or neurological condition like cerebral palsy or muscular dystrophy. Alright, so the symptom of DCD can be very widely among individuals, but they often include poor hand-eye coordination, clumsiness, a difficulty with fine motor skill, and balance spatial awareness issue. So let's see one by one. So for hand-eye coordination, it making tasks like handwriting or using utensil challenging. And for clumsiness, people with DCD tend to bump into things or trip frequently. All right. So for difficulty with fine motor skill, so actually, people with DCD have difficulty with his or her fine motor skill, such as buttoning clothes or cutting with scissors. All right. So lastly, balance and spatial awareness issue. So these difficulties is actually require a balance or spatial awareness like riding bike or catch ball. So the prevalence of developmental coordination disorder in children can be vary depending on the criteria that used for diagnosis and the population studies. However, it is estimated to affect a significant portion of the child population. So in prevalence, let's see in both children and adults. So for children, DCD is actually one of the most common developmental disorder in children, and it is prevalent varies across study and region. So it is estimates suggest that DCD affect approximately 5 to 6% of school age children. So it is actually more common in boys with a male to female ratio of about 2:1, and this gender difference may be due to the fact that boys are more often referred for evaluation and diagnosis. So if let's see about the persistent in adulthood. So DCD is not condition that children necessarily outgrows. So it often persists into adolescence and adulthood. So many individuals who were diagnosed with DCD in childhood continue to experience motor coordination difficulties throughout their life. So as a children with DCD grow older, the specific challenges they may face evolve. While they may have received therapeutic intervention and developed strategies to cope with their condition, that they still have difficulties with certain motor tasks and coordination. So the impact of DCD in adulthood can extend beyond motor coordination. It can affect an individual's ability to drive, participate in sport, and even perform specific job related. All right, so for diagnosis, so the diagnosis process for DCD is actually involved through assessment and collaboration of healthcare professionals to determine if a child or individual meets the criteria for the condition. Um, so it is important to note that diagnosis of DCD is not a one-time event, but rather an ongoing process that may require periodic re-evaluation to monitor progress and adjust intervention as needed. So early diagnosis and intervention are crucial for providing a necessary support and therapy to help children with DCD and develop their motor skill and lead fulfilling life. All right. The Actually, the causes of DCD is not fully understood yet, but it is believed to result from a combination of genetic, neurological, and environmental factors. So now let's look at these other causes. So first, genetic factor. So the evidence to suggest a genetic predisposition of DCD if a family member such as parents or sibling has history of coordination difficulties, there may be an increased risk for DCD in family members. But, however, DCD is not solely determined by genetic, and multiple genes may be evolved. Alright. Second, neurological factor. So, DCD is often associated with differences in brain structure or function. So, brain regions are actually responsible for motor planning, execution, and coordination may not develop or function properly in individuals with DCD. So, these neurological differences can lead to characteristic difficulties in motor skill. All right, next let's look at premature birth or low birth weight. So, children who are born prematurely or with low birth weight are at a higher risk of DCD. Why? Because premature birth may result in underdeveloped motor skill, which can contribute to coordination difficulties later in life. All right, now let's see at environmental factors. So early experiences and environmental factor can influence the development of DCD. For example, the lack opportunities of physical play and exploration during early childhood or adverse prenatal conditions such as maternal smoking during pregnancy or traumatic brain injury. Okay, let's continue with psychological factor. So while not a direct cause, is psychological factor which can exacerbate the impact of DCD. So the frustration or low self-esteem that often accompany coordination difficulties can affect a child motivation and willingness to engage in physical activities and potentially worsening the condition. All right. So lastly, developmental factor. So DCD typically become noticeable when children are expected to perform more complex motor tasks. So such a handwriting and learning to ride a bike. So developmental factor related to the timing or sequence of motor skill acquisition that may play a role. So DCD can have significant impact on various aspects of individual life, so particularly in childhood or and beyond. The impact of DCD can be vary from person to person, but it often includes these five areas. So the first one is academic impact. So children with DCD may have difficulties with the tasks that require fine motor skills such as handwriting, typing, or drawing. So these challenges can affect their academic performance and make tasks like taking notes or completing assignment more time consuming. Next is impact in everyday life. So basic daily tasks like dressing, grooming, and even use utensil may be challenging for individual with DCD. So these difficulties can impact their independence and self-care skill. Next, the safety concern is also the main issue in DCD. So Poor coordination can lead to an increased risk of accident and injuries as individuals with DCD may struggle with activity like crossing the street safely and navigating the stairs. Okay, fourth, social and emotional impact. So coordination that difficulties can lead to clumsiness and difficulty participate in sport or recreational activities. So this can result in social isolation and low self-esteem, as children with DCD may feel different and excluded from their peers in doing that activity. Lastly, relationship. So the emotional and practical challenges posed by DCD can affect personal relationship. So individual may need support from family members, friends, and partners to manage daily tasks and cope with the psychological impact. So, in conclusion, it is important to recognize that DCD presents significant challenges. An individual with this condition can develop strength and strategies to overcome many of these difficulties. All right, strategies for DCD. So actually, there is no exact cure for DCD. So various strategies and intervention can help individuals manage their difficulties and improve their motor skill. So here is six suggestions to overcome DCD. So the first one is occupational therapies. So, occupational therapies can provide individualized therapy to improve fine motor skill and gross motor skill, balance, and coordination. So, they help individuals with to develop strategies to manage their daily activity. All right. Second is physical therapy. So physical therapies focus on improving physical strength, flexibility, and posture. So this can contribute to better coordination. All right. Third is speech therapy. In some cases, speech therapy may be beneficial, especially if there are associated communication or language issue. So fourth is psychological support. So psychologists can help individuals cope with the emotion and psychological challenges associated with DCD, such as addressing issues like anxiety and self-esteem. All right. Second last, education and awareness. So raising awareness among teachers, peers, and family members is important. Educators can make an accommodation in the classroom to support the child's learning and participation. All right. So lastly, adaptive tool and technology. So by using adaptive tool and technology such as specialized pen or keyboard can make academic and daily tasks for DCD people more manageable and easier. So you can try these kinds of strategies at home if you know or have um, meet someone with DCD and try to suggest them this strategy. So, in summary, developmental coordination disorder (DCD) affect a person's ability to coordinate physical movement. While there is no cure, early diagnosis and support are important. So, understanding the condition and providing assistance at home and in school are very crucial. So, individuals with DCD can develop strategies to improve their skill and lead fulfilling life with the right help and support. Awareness and education about DCD are essential for better understanding and empowerment. That's all for today. Thank you very much for listening to this presentation.